Hello, and welcome to episode 25 of Live with the Glitter Practitioner. I can't believe where this time has gone, actually. Episode 25, it's incredible. So, for those of you who don't know me, I am Dr. Nupi, the Glitter Practitioner, and I am a doctor. I'm a family physician in the UK, and I'm also a spiritual and transformation life coach. And my absolute passion is integrating mind, body, and spirit as whole self health needs and showing and sharing others how to keep those aspects in alignment, in balance, so you can be your bestest, most radiant self. And I do that through a framework which is called my F list, which I developed. It came to life really after my own experiences of burnout, which was 12 years ago. So everything I share really is what I've learned. I've then discovered more and passing it all on. Today's guest is somebody very, very special. And I think her wisdom and what she has to share with us today is going to resonate with quite a few of my wonderful, fabulous female viewers. So without further ado, I would love to bring on Dr. Victoria. Come on down.
Hello.
Oh, yeah. I'm so sorry. I normally have my shells as a welcome. Hi.
Thank you.
Hi.
Hello.
Oh, it's so good to see you. Look, I am honoring Vulva la Viva. Viva la vulva.
We all came in pink.
Indeed. I've even got matching pink glitter. I don't know if you can see in the light.
Yes, gorgeous. Gorgeous.
Thanking you. So, Dr. Victoria, thank you so much for joining me today. I can't wait for this conversation.
Thank you so much for having me, Dr. Nupi. I love to be here with you. I adore what you do, and it's my pleasure to talk with you.
Thanking you. So, tell everybody what you do and your specialty interest.
Well, I am a family physician. I practice in Southern California. I've been practicing for 16 years. And I developed an interest in menopause health a few years ago when I went through that journey myself. And I realized that as GPs and FPs, we're wildly underprepared in med school and even residency to help our women patients go through this transition. So I sort of deep dived, read the books, read the journals, watched the podcast, spent hundreds of hours trying to figure it out for myself. And in doing that, figured, you know what? It's not that fun if I'm the only one who's got it figured out. I wanted to take all of my friends and my family and the people in my circle with me. And that is why I started Feminine Flame MD, to bring everyone on board with me.
I love it. I love it. And you embody, for me, because we've spoken and we had an amazing chat the other day even. And to me, you really do embody what it is you teach and share, which is women in their 40s plus, too right. You can be your bestest, most radiant self and really keep stepping and going further into your power. It doesn't have to stop there. And it's being sensual with that and joyful and just embracing the changes that occur, as opposed to, oh, that's it now. That's it.
Yeah.
No way.
Yeah.
So
absolutely.
Tell us more. Tell us more.
Well, I think exactly what you referred to is why most of us. So the physicians are underprepared in med school, and the women are underprepared in life for the exact same reason that you mentioned, that, when we're in middle school, they pull us aside and tell us, all right, when you're about 13, you're going to get your period. This is how you take care of yourself. This is what you can expect. But then when you hit 40 something, nobody pulls you aside and says, all right, you're going to lose your period, and this is what you can expect. So we're missing that second conversation. The physicians are missing talking to their patients about it. The women are missing knowing about it. So we sort of enter the whole thing blind. So it's kind of scary. Aging is like, oh, I don't want to age. I don't know what's going to happen. We're just underprepared. So for me, when I was 42, I started having irregular periods. And I didn't think too much of it. I thought, well, you're a little stressed. You're working too hard. You got a couple extra pounds on. It's not a big deal. And who misses their period anyway when you're 40 something? You don't miss it. You're like, whoo, okay, I got a break this month. But when I was 44, I stopped having my periods altogether. And then I got hot flushes, heat all through my body, sweating at the wrong time of day every day, and couldn't sleep to save my life, could not sleep at all. And I don't know if anyone out there has ever struggled with insomnia, but if you can't sleep, you can only put up with that for a couple days, because then you start feeling super stressed and super tired and super worn out and exhausted and anxious. And so here I am, I'm a female doctor, and I didn't realize I was in the throes of classic menopause. I thought menopause was after 50. I thought it was for older women. I thought I had plenty of time to figure out what I would do when it came. And I didn't know then, but I know now that menopause on average can happen anywhere from 45 to 55. I was a little early, but she's different for everyone. She doesn't follow the guidelines. She does what she wants to do in her own time.
Well, we're all unique. We're all absolutely unique.
So unique. And the funny thing about menopause is you don't know you're in it till you're already in it, because the definition is 12 months since your last period.
Yes.
And so by the time you're there, you've already been 12 months into it. You might have a couple false starts, like, I think I'm there, and then another period. And
That's
then
right.
3 months go by. I think I'm there, and then another period. So when it's been 12 months and you're in your mid to late 40s, that's menopause. So can you imagine a condition that impacts half of the entire world's population? 1 billion women in the world, 50 million in the US where I live, and yet nobody's adequately prepared for it. We're not talking about it enough. I think that's starting to change now, but not nearly enough, because it's not just losing your period. It's like you're about to enter into this transition where your whole body from head to toe is about to change in sometimes irreversible ways. You start to feel symptoms for some of the changes, but not all the changes give you symptoms. For example, if your bones get thinned out and you get osteoporosis, you don't even know about it until it's kind of too late. So it impacts our whole body. And just a couple of the symptoms: hot flashes, night sweats, insomnia, difficulty concentrating. Some of the symptoms are things we don't talk about or know about, but difficulty concentrating, daytime fatigue, brain fog, palpitations. So a lot of women go to the doctor with palpitations. Oh, it's a panic attack. Oh, they check their heart. Oh, you're fine. It's menopause. Anxiety attacks, depressed mood, crying, irritability, dizziness, muscle aches, joint pain, bladder frequency, frequent urinary tract infection, vaginal dryness, vaginal burning and itching, and pain with sex. I mean, it's the whole gamut, literally from your brain to your pelvic zone to all your joints. Menopause can happen to your whole body.
Absolutely. And it's so, I think when people present and they're saying symptoms, and it's taking that overall picture, isn't it? And looking at somebody's age and saying, okay, the likelihood is that your hormone levels are up and down. This is what you expect. And just knowing that, the number of patients I used to speak to who would just say, oh, thank God for that, I'm not losing my mind, because it just all feels all encompassing, especially the impact on physical health. That's one aspect, but the emotional side and the sleep, which then just compounds everything else, it's bloody awful. It can and it really can debilitate you in terms of work. So you're used to being on it, sharp, doing this, you're in your late 40s, early 50s, and all of a sudden there's like you're going through molasses again. It's not great.
Yes. Absolutely. And some of the symptoms we don't even feel comfortable talking about with our
Yeah.
friends, let alone our doctor, let alone a professional. But so head to toe, genital urinary syndrome of menopause, that's like the medical way that you and I have to talk about what happens down below.
Let's get the
And
puppet out.
yes, so the wondrous
Come on.
velvet puppet. So some women don't even know the name for their beautiful anatomy. So if we can't name it, we can't have a conversation about it.
Yeah.
For example, everyone always says vaginal dryness, vaginal pain, the vagina, my vagina. And yes, we do have a vagina, but that's the canal. That's the birth canal. That's the inside. And that's where we deliver the babies through, or that's where we have penetrative sex. But the vulva is the name for everything on the outside. The labia, the outer labia, the inner labia, the clitoral hood, the clitoris, the pleasure center, the urethra, where we pee from. All of that, that's the vulva. And that's where we can start to feel symptoms. We can get the dryness, the burning, the itching, the frequent urination, the burning when we pee. A lot of women will go to the doctor over and over again in their menopause years with bladder infections, UTIs, over and over, and they'll get antibiotics over and over. And no one will think to ask, why do you keep getting a bladder infection? Because they're suffering already genital urinary syndrome of menopause, and that's impacting their vulva. And of course, it's causing dryness and pain with sex, but it's also putting them at risk for infections over and over again.
Yeah, absolutely. And the number of times I used to see women, mistreated, thinking it was thrush, or which it probably was with all the antibiotic prescriptions, thinking it's a UTI.
Yes.
And, simple things that are going to help down there, which is going to be, topical estrogen, for example, which we can come on to, because I know a lot of women are, I think people get really scared because of all the, oh my gosh, I can't use that. It's going to go into the system. And oh my goodness, no, it's going to give me X, Y, Z. So I'd love you to talk to us about that as well. But these are simple, very easy things to actually improve your vulval health. And which means, those symptoms are horrible. The itch, the dryness, it keeps you up at night. And these are just extra things that you don't need.
Yes. So 80% of women are going to feel vulvar symptoms, genital urinary syndrome of menopause. And they're going to suffer, and they're going to think, oh, this is just an inevitable part of aging. There's nothing I can do about it. Plus, it's embarrassing. Plus, it's painful. And they don't have to suffer in silence, because like you said, we have effective and safe treatment for it. And what is that? Well, if we think about what causes the menopause symptoms, it's a drop in estrogen. Before menopause, our ovaries, they just churn out this beautiful hormone that takes care of us from head to toe. And when we hit menopause, the level of our estradiol that our ovaries produces, boom, it just crashes. So everything that estradiol was supporting before is going to be impacted. That's why we get head to toe, because there's estrogen receptors in our whole body. So we can treat this, and it's safe for most women, and it's effective, very effective, and it's topical low-dose vaginal estradiol. And it can be prescribed in a cream, which can be applied just to the inside of the labia, down the clitoris, around the urethra. And that won't just help the dryness and the itching, but it'll actually reduce the amount of kidney and urinary tract infections that a woman has, and it can improve her bladder symptoms of frequent urination and sneeze and pee. A lot of women think that's inevitable. It does not have to be inevitable.
Yeah, absolutely.
And it's safe. And our GP, like Dr. Nupi, or our family doctor, like Dr. Victoria, or our OBGYN, can safely prescribe low-dose vaginal estrogen. It's safe for most women because, like you said, it's not even systemically absorbed. It just stays right where we put it, and it does its job very well. Our vulva does so much for us our whole life. We can show her gratitude. We can thank her. We can give the girl a little estrogen.
I love it.
Show her gratitude for everything she's done for us.
I love that. I swear. Where did you get that puppet from? I have to know.
A wonderful woman in the Bay Area of Northern California hand sews all of these
Oh my
puppets.
gosh.
Wonder vulva puppet. That's what they're called.
Oh
I
my
love it.
gosh.
I
It's
love it
brilliant.
because she's beautiful and we can talk about it
Yeah.
and we can know the proper names for things.
Yes.
And if a woman doesn't remember anything else from our whole conversation today, remember that you don't have to take these genital urinary syndrome of menopause lying down.
Yes.
You don't have to accept it as inevitable. You can get safe treatment from your doctors. Okay? Deal? Let's
I
treat
love
the
it.
girl.
Like, absolutely. Show her some respect.
Absolutely.
Basically. Absolutely.
She does a lot for us.
Yes. And it's not, and it's also, you know, other things as you were talking, it also affects your hair,
Yes.
your skin,
Yes.
all of these other things as well, and your mood. I think that's a really crucial one, which we might need to do a part 2 and just focus on that. But if we have, I'd love you to, you know, let's have a quick chat about that, because that's a huge part of menopause as well. The way it affects your mood, not just the sleep, but how you feel within yourself.
Well, I think it's all tied together, right? Because we're just one woman, and
Yeah.
all of this happens inside of this one woman. And how can we get, how can we get tipped off to know that what we're feeling is due to menopause? We can get tipped off because of this brilliant, ingenious mechanism that this wizened woman's body has come up with. This wizened woman's body has come up with the hot flash. The hot flash. A lot of women are like, oh, the hot flash. I say, yes, the hot flash. It's not just a hot flash. It's a news flash from this brilliant, feminine, divine feminine wisdom that's telling you, pay attention to me. I don't have estrogen. It's all about to change, Victoria. And that is what we can look to. So if we're mid 40s, early 50s, and if we're having hot flashes, think about it. We're having hot flashes. We're having night sweats. We can't sleep at night. We can't focus the next day. We're irritable with our family. We're lacking self-confidence. We're feeling anxious. We're crying without reason. It's the whole thing. And if we can find that signal, hot flashes, because over 70% of women suffer from hot flashes. And in medicine, we call that vasomotor symptoms. And if we're having those, we're tipped off. We know we're having menopause. There's very rare non-menopause causes, and we can talk to our doctor and make sure it's not that, but common things being common. If we're late 40s, early 50s, and we're having hot flashes and we haven't seen a period in a year, it's likely menopause. And women don't know about it, so they don't go ask their doctors about it. So they usually don't get treatment for it. And if they finally develop the courage, the gumption to go in and ask about it, oftentimes they might just be sort of brushed aside, like, oh, it's a little menopause. You'll be all right. Or if they're super lucky, they might be offered some antidepressants or some blood pressure medicine. Why, you ask? Because those medications, antidepressant medicines and blood pressure pills, certain blood pressure pills in certain women have been shown to help some of those hot flash symptoms. And some doctors feel more comfortable prescribing those treatments than actual menopause hormone therapy, which is kind of wild because we have FDA approved treatment for it. And we have guidelines that tell us that we can be prescribed it, but a lot of doctors aren't sort of up to date on the guidelines. I wasn't before I went into menopause. And when we went to med school 20 or 30 years ago, we were given a message. And the message back for me in 2000 was, stay away from hormones. Try not to prescribe them. They're very dangerous. And if you prescribe them, just give them for a little time and as low as possible. But the guidelines have changed since then. There's been updated, published guidelines that let us know that for many, many women, it is worth, there are so many benefits for them. And that FDA approved menopause hormone therapy is very, very effective. And for the most part, very, very safe for most women. It's just that we don't know what to ask for. And our doctors aren't updated. So it kind of puts the onus back on us to get the information so that when we talk to our doctor, we're coming from a place of wisdom,
Yes.
of confidence, so that we know what to ask for, so that in case they say, oh, don't worry, it's just a little hot flash, we could say, well, doctor, did you know that some women, the hot flashes only last a year or two? But for some women, it can last for 10 years or more.
Yeah.
And the doctors may not know that. And if you think about it, if you're having hot flashes and night sweats and you're not sleeping and you're tired and you gain weight, because we know that insomnia goes with weight gain, and you get more abdominal obesity in your belly, you're going to have a higher risk of diabetes. You're going to have a higher risk of heart disease, all because you didn't get your menopause symptoms addressed. So it's not just about comfort. It's about your well-being.
And that's how we integrate the whole thing. Yes. And as what Alex had said earlier, actually in the comments, was no more putting up with, you don't need to put up with this. Yeah. And it's being informed and making that decision. And I think, you know, you said again, it's not just when you've been through menopause, which is your last period for 12 months, and that's how you know. Don't forget, there's a big chunk leading up to that, which is perimenopause, which, you know, blood tests aren't always going to be that useful because your hormones can fluctuate.
Yes.
Go by your symptoms. So if you're having these hot flushes at night, you're feeling not right, foggy, your periods are going more erratic or longer or heavier, there's a change. That's the bit leading up to menopause. And that can, again, last a few years. And I think, no, you can't just, it affects you top to toe, as you've said, Dr. Victoria. And I do what's right for your body, be informed, and make those decisions. See if it works for you. Don't deny yourself, is what I would reiterate there.
Don't take it lying down, and don't allow yourself to get brushed aside.
Yes.
And I feel like the tide is turning. I feel like more women are starting to talk about it and demand treatment, and more doctors are responding to that by getting informed. But we're just at the beginning. And if we realize that it's, you know, 1 billion women on earth, we are not anywhere near those women being treated. Less than 5 to 10% of women are taking menopause, FDA approved menopause hormone therapy. Less than 5 to 10%. But we know that 80% of them are having symptoms. So that's the disconnect between the amount of women having symptoms, most, and the amount getting FDA approved treatment, very little. And the gap, unfortunately, is both our responsibility to be proactive. We have to get informed. We can't wait for someone to come rescue us, because we are the help and the rescue that we need. We have to be, we're grown women. We've got some gray hairs. We've got some mileage on us. We are doctors. We're lawyers. We're teachers. We're business women. We raise families. We're mamas. We do a lot. Women are pretty freaking amazing.
Totally agree.
This is one more thing that we've got to take proactively, and we've got to hit it head on. So the onus comes back on us to inform ourselves. We have in America, we have the North American Menopause Society. They put out guidelines just this year, after this 20-year gap of this sort of misinformation, undue fear, sort of menopause hormone phobia. They came out this year and said, and this is after extensive literature review, extensive research studies, they said, menopause hormone therapy remains the most effective treatment for vasomotor symptoms and the genital urinary syndrome of menopause.
There you go.
And has been shown to be effective. So for women that are younger than 60 or within 10 years of starting menopause and have no contraindications to hormone therapy, the benefit to risk ratio is favorable for the treatment of their symptoms.
Yes.
So there we have it. If you're within 10 years of your last period and you're having those symptoms, vasomotor or genital urinary, the benefits are outweighed by the risk for most women. And of course, it's nuanced. And of course, there's exceptions. And of course, there's risk, because there's risk with everything.
Yes.
We've got risk with ibuprofen. We've got risk with vitamin D. We've got risk with literally aspirin. Everything has risks. But for this one, this is worth us taking the time to dial down and find out, okay, what is the risk? And not just what's the risk, what is the benefit to the treatment of my symptoms? Because here you have them saying the benefit outweighs the risk. And it's your whole body. If menopause impacts your whole body, the benefits are to your whole body.
Yep.
And imagine if we flip this whole thing around and we did it different. We didn't do it like I did it. We didn't stumble blindly into menopause in isolation and sort of anxiety. Imagine if we did it with confidence and well-informed. And when our time came, we went to our doctor from a confident standpoint and said, you know what? I've done the research. I know how menopause is affecting my body. I know what my treatment options are. And this is what I want. Let's talk about it. Let's talk about my specific medical health conditions. And let's talk about getting me on menopause hormone therapy, because I think I fit the guidelines and these are my symptoms. Imagine how different it could be, and how many more women who have symptoms and who are right now suffering in silence alone. Imagine if they got their treatment and if they don't, they get to decide.
Yeah.
If a woman does the research and she decides she doesn't want it because it doesn't align with her values or her symptoms, beautiful. That's her decision.
Yes.
She didn't fall into that by default or by being brushed aside.
Yeah.
She made a proactive decision. I don't want that. I'm going to do this another way.
Yes.
Beautiful. And if she looks at the research and she looks at the benefits and the risks, and she decides, you know what? I'm suffering and I want help. And I know what the risks are. And these guys say the risk is worth the benefit. You know what? I do want it. And now I'm going to talk to my doctor from that standpoint. That is what I'm hoping for women. That is why I developed Feminine Flame MD, so that women could be educated and given guidance and walked through exactly how to approach their doctors, so that they have a better chance of coming out with effective and safe treatment for their, taking into account everything, because it's so much more that we can count, cover in 30 minutes. It's so huge. It's our whole lives, but we are worth the time it takes to figure it out.
Yes.
So if a woman feels that she's worth it, and you all are, invest in yourself. You could go to feminineflamemd.com. You could download my free video guides. You could sign up for my menopause mastery course, and you could invest just a little time and energy on something that will impact you for the rest of your life, because menopause just doesn't happen for a year. We live in menopause. If we're going to live to be 80, 100, we're going to live in menopause for 50 years.
Absolutely.
Let's do it right.
Yes.
Let's do it well.
I'm not taking anything less. Absolutely. It's your quality of life. And no, I refuse. No way. Yeah. You go through your, in teenage years, obviously you're a kid, in your 20s and your 30s, you're just about getting there, then in your 40s, you're getting more savvy with everything. And you're pretty much getting to the top of your game. Why does that need to stop in your 50s, 60s onwards? No, absolutely not. And that's what keeps you young as well. Absolutely.
Yeah, we can have it all. We
yes,
get the
we
wisdom.
Can.
We have our jobs. We've had our families. We took care of everyone else. Now it's time to take care of us.
Yes.
And we can thrive. We don't have to shrink away and get osteoporosis and go hide in a corner and go invisible. I would love to reframe the way that older women are seen. It's not like, oh no, I need plastic surgery. Oh no, or I'm just invisible and I've lost my radiance. It doesn't have to be that way. We don't have to do it that way. That's the way many of us are doing it, but we don't have to. It's just that we don't have the knowledge and we don't know what steps to take. But when we do, when a woman's informed and motivated and confident, she's really unstoppable. Amazing. And I would love to see that for all women.
Absolutely. Well, you're doing that. And that's the whole point. I really wanted to bring you on tonight or today, noontime and Pacific Daylight Time. This is I think this is vital. What you're delivering, what you are showing, it's not just physician. This is for patients so that you are well informed and you can go to your physicians and say, well, okay, look, this is what I've learned. This is what I know. Let's have a conversation. And I think to reiterate that as well, I would also say it's perfectly okay to have a second opinion, because one doctor might be very well informed and somebody might not be. That's fine.
Yes.
If that's what you've decided and there's a barrier, okay, go for a second opinion is what I would also add to that. Don't just settle for that.
Absolutely. If you get brushed aside, maybe they're right. Maybe you're not a candidate. I don't know. Everyone has a specific circumstance.
Absolutely.
But it's okay to get a second opinion, and it's okay to make sure what your options are.
Yeah, absolutely. Wow. We need to do a part 2, because I think the emotional aspects of all of this is another topic in itself, really.
Yes.
It's gone so quickly. It's felt like about 5 minutes.
I know.
Thank you. It's incredible. So tell everybody how they can get hold of you.
They can go to my website, www.feminineflamemd.com, and they can download the free video guides, and they can sign up for the Menopause Mastery course. They can follow me on Instagram at feminineflamemd, and really just take the time to invest in yourself, because it's your whole future we're talking about. And the way you handle it could impact the trajectory, the quantity, and the quality of the rest of our lives, which hopefully is a long time.
Yes. Yes. Oh, incredible. Thank you so much. So much wisdom tonight. So much to just digest. And I think, you know what? People, get in touch with Dr. Victoria. She's got these resources. The more you learn for yourself, the more you are informed. You take that control back, is what I would also say. Oh, thank you. Thank you so much.
Thank you so much for having me. I love what you do. I love your podcast. I'm always in your chat because I'm loving what you do. Thank you so much for having me. And I would love to come back and talk even more about it.
Definitely. I'm going to just wrap up, but I will come back. Don't go anywhere. I'll come and join you in the green room.
Bye-bye. Thank you so much.
Wow, that went so quickly, and we've still got so much to talk about. I really hope you have enjoyed tonight's episode, and I think without shadow of a doubt there has to be at least another 2 more parts to it. And I completely forgot to mention my own program actually at the start of the show, which is Find Your Fizz and Flourish, which is my coaching program for female professionals, executives, female physicians who are feeling fed up, FFS, I won't say the words, frazzled, exhausted. Maybe you're questioning, is this it? Come and have a chat. You can contact me, direct message me on LinkedIn, or book a call with me on my Calendly link, which is on my About section, basically all over LinkedIn. You can also find me on YouTube and also on Instagram and Facebook, all as the Glitter Practitioner. And to give you a flavor of what it might feel like to go through the process of finding your fizz and flourishing, my brand story, which was created by Devon James Stinson, pretty much sums up the essence of what that feels like. And I forgot to ask my wonderful Mr. Producer to play that at the beginning. So we're going to finish up with that. And I just wanted to say before I say goodbye, happy Thanksgiving week. And I hope you're all having a wonderful week or if you're off this week, wonderful Thanksgiving. And I am very grateful for my amazing producer and all my guests who have graced me with their presence and joined me every Monday for the last 25 weeks. It's incredible. So I just wanted to say thank you for that. So, Mr. Producer, let's play the brand story.
follow the light through the storm. And this is not a light that warns, it's a light that forms on the pathway ahead. So you can maneuver around disaster instead of getting stopped by the obstacles. It just takes changing the obstacles. And then the impossible turns to possible. And then the storm lifts. You're no longer adrift. Breathe, focus, you've got this. Ahead you see a figure, a kind soul, and on the inside it feels like you might glow. Your endless cycles of cyclones have been turned to a breeze that just slightly blows. You're adorned with glitter, where you literally feel like a kid again. And this is when you realize how much of your life you've missed. And then you talk more with Dr. Nupi Aurora, who will holistically change your aura, where you and the new you won't be like strangers. No, you'll be like friends. Because this whole process is simply life-changing. So if you're feeling frazzled and you want to find your fizz and dazzle, then book a call with Dr. Nupi Aurora by messaging her right here on LinkedIn.
Oh, that gets me every single time. And I know I say that every week, but it is beautiful. Thank you for joining me this week, and happy Thanksgiving again. And I shall see you next week. Bye.